At the foot of the Mwangea Hill in Ganze constituency lies Ndugumnani village, which due to its location on the lee side of the hill is extremely dry and parched. The levels of poverty caused by perennial crop failures in the village have led to famine and extension malnutrition among both children and adults, as well as frustrated reproductive health initiatives. This situation has made some non-governmental organizations to come to their rescue and offer reproductive health education and other health services. The organization's director, Ms. Nelly Munyasia, says her organization is responding to the famine crisis in various parts of the country that were declared to be food deficient, but since her organization cannot be able to offer relief food, she has appealed to the government and humanitarian organizations to send emergency relief food to areas affected by drought, especially in Ndugumnani area, where she says the level of poverty is unfathomable.
The problem here is food. There's famine, there's no rain, there's drought. So really, you can see the faces of the population speaks. You see a mother carrying a baby. The baby is malnourished. The mother herself is also equally malnourished. For us, we are just responding to their reproductive health needs. Like I said, contraceptives, access to contraceptives. Pregnant mothers need to be seen. They cannot go to facilities because they can't even afford the transport to the facilities.
Anastasia Amina Paula from Tsikunze village says that she gave birth to her firstborn child when she was 15 years old. She blames poverty for her predicament, lamenting that she had to rely on a young man to provide basic necessities such as sanitary towels, as her parents could not afford to buy food as well as the towels. In the process, she was forced to accede to sexual demands from her benefactor and became pregnant, something that irked her parents.
Mimi msichana ambaye nilizaa nikiwa niko na miaka 15. Changamoto ambazo tunazipata mpaka tunazaa tukua bado tuko na umri wa chini. Umaskini huku umekithiri. Unakuta kama ni mambo na sodo, mzazi hana ile pesa ya kupata sodo. Sasa inakubidi kuna kijana yeye yuko nayo ile pesa ya kwa anaweza kupa ukapata sodo. Sasa anakupa, lakini baada ya hapo kuna malipo ambako ni kufanya kitendo cha ngono na yeye. Kufanya kitendo cha ngono ni hiyo mimba ambayo unapata usipokutarajia.
She also blames peer pressure and a don't care attitude among some parents on the needs of young girls, leaving them in the hands of sex predators who approach the girls as good Samaritan only to leave them devastated. She is, however, grateful to the organization which through its She Decides program has reached out to the village with sensitization messages on reproductive health as well as providing the services free of charge.
Kitu chengine ni peer pressure. Tuna msukumo wa marafiki. Hawa marafiki zetu wenye tuko nao wengine, unakuta yeye ana uzoefu na kile kitendo cha ngono, wewe nao anakushawishi pia unaingilia kwa hiyo group. Kitu chengine, hawa wazazi wetu pia wanachangia, kwa sababu saa hivi venye kuko na hii hali ngumu ya uchumi, wanaenda kazini hawa wazazi. Huko kazini hata hawatajua huku nyumbani ni kitu gani kinaendelea.
Saumu Chengo, not her real name, says that she has been forced to secretly seek reproductive health services because her husband rejected the use of any kind of contraceptive. Saumu says poverty and poor spacing of children have caused many women in the area to suffer as they are unable to continue breastfeeding their infants while they are hungry or pregnant, thus adversely affecting infants still suckling.
Ukame ambao umezidi huku. Utalala ukiamka, utatafuta kama ni kibarua, hakuna kibarua unachopata. Ukienda kwa bwana ukimhoji, mimi nitafanya nini? Nataka nitumie family planning. Mzee anakwambia sisi wenyewe tumezaliwa karibu 10 na ni sharti wewe uzae mpaka umalize hao watoto wote.
This scenario is replicated in many homes within Ndugumnani location and other villages such as Tsikunze, with some girls being forced to marry elderly persons after being jilted by their age-mate lovers who impregnated them. Mary Haluo Charles, a college student, echoes the sentiments that peer pressure and poor parenting has led many young girls to engage in sexual activities, and since there is little education on reproductive health, many of them get pregnant at a tender age, urging parents to take their responsibilities seriously in order to secure their children's future, while also urging fellow youths to abstain from premarital sexual activities.
Changamoto zenye watu tunapitia sana ni peer pressure. Unaona ule msukumo wa marafiki, ndio nakwambia basi rafiki yangu ana boyfriend, pia mimi ama rafiki yangu ana touch, mimi sina. Mimi lazima nifuate mtu mwenye yuko na pesa ili nifanye nini? Nipate ile touch, unaona? Sasa ile akifuata alafu ukiangalia nyumbani kwao ni poverty.
Men have also been cited as great hindrances to the uptake of reproductive health services, with women interviewed within Ndugumnani area saying their husbands have not embraced the idea of planning their families. Jonathan Mangaro from Sokoke Wards concedes that men have refused to embrace family planning, and he agrees with them. He is also opposed to the use of condoms and wants non-governmental organizations to promote the use of traditional means of family planning, such as helping women to identify their safe days.
Inabidi zile sindano sisi tunazikataa. Tunasema afadhali wasidunge hizi sindano. Na mara nyingine hata hisia zake zinakufa. Lakini wangekuja na mbinu mbadala zile za tunapanga uzazi lakini hatutumii dawa. Hizo zingekuwa na uzuri zaidi kuliko vile wanavyopanga za masindano.
The residents are appealing to the government in partnership with other stakeholders to come to their rescue and help them get relief food and also add more health facilities, as most of them have to walk for long distances to get health services. Nicole Mwanza for Ebru TV.